Chege. The World Health Organization on Tuesday said it regrets U.S. President Donald Trump's decision to withdraw the country's membership of the organization. The UN agency has urged the U.S., which is its top donor, accounting for 18% of its finances in 2023, to reconsider the decision. Public health experts in Kenya have warned that the looming withdrawal will have far-reaching ramifications to the international fight against global health crises. The Ministry of Health has downplayed those concerns and assured the public that public health will not be compromised in any way. Kicking us off on The Explainer tonight is Mary Mwoki.
First item that President Trump is signing.
The decision by U.S. President Donald Trump to withdraw the United States from the World Health Organization has triggered strong reactions from public health experts who say the decision will not only undermine the nation's standing as a global health leader, but will also have far-reaching consequences on the public health landscape in the country. The announcement to suspend all U.S. foreign assistance programs for 90 days has also put in jeopardy the financing of various health programs in the country.
We should be worried. And the reason we should worry across Africa and in Kenya specifically is that our governments have left the HIV programs to be predominantly externally funded.
Again, they play a very important role in providing guidelines, in providing technical assistance, in coordinating things like research, which is very important in enabling the whole world to now employ an evidence-based approach.
Dr. Gitahi says withdrawal of the United States Global Fund and PEPFAR, which is the U.S. President's emergency plan for AIDS relief, would be catastrophic to the fight against HIV/AIDS in the country and risks clawing back on gains made. The public health expert pointing at Kenya's over-reliance on external funding for a docket as crucial as the health sector and challenging the government to find alternative ways to finance the health sector.
Where is Kenya going to get the leeway to actually bring in $30 billion if they struggle with a gap of $1.5 billion already right now? So I would say that is not possible, which means that it's actually going to have a huge impact on provision of testing, because this money also buys the test kits, provision of ARVs to the people living with HIV, and also to ensuring that they are sustained on treatment.
You cannot delink one healthcare service from the rest of healthcare services. It means organizations that have been providing maternity care, that have been providing other treatments.
Kenya's healthcare sector is heavily reliant on donor funding, with the announcement by the U.S. to suspend all U.S. foreign assistance programs for 90 days a major concern for health experts in the country. PEPFAR and the Global Fund are major donors in the fight against HIV, and pulling the plug on those two funds would have devastating consequences.
It means that a withdrawal of PEPFAR would withdraw 40 billion shillings a year. Which worries me, because now, if that ends cold turkey or suddenly, where is Kenya going to get 40 billion Kenya shillings a year to actually address the HIV program? My honest view is that reproductive health is the country's first social investment. And that cannot be left to neighbors or friends. Because when you think about reproductive health, you're talking about the country's socio-economic development.
However, the Ministry of Health has downplayed the implications of the looming withdrawal of the U.S. from the WHO. The Deputy Director in the Ministry of Health, Dr. Sultani Matendechere, has said, although the withdrawal would greatly shock the global health architecture, the world will pull together and find a way to fill the gap left.
One is not safe until all are safe. If WHO is not functional, the U.S. could be exposed in terms of even pandemics, outbreaks, epidemics arriving into the U.S. So there must be something which is most likely now along the bilateral lines, which is now being proposed, that we will wait to see how does it look like.
Global health experts and UN agencies have urged President Donald Trump to reconsider his decision, saying the U.S. leaving WHO would weaken the global health agency. Mary Mwoki, Citizen TV.